Well, my favorite are those who have their first psychotic break, because they're young, they want to do better. Um, but they are also your most challenging because they're resistant to conventional treatments. And so it's an opportunity to learn from them and them learn from you. And I always talk about, as I said before, you know, making sure part of their treatment modality is the psychoeducation piece. Walk me through when you started noticing something. Walk me through when you had your first fight. Walk me through when you smoked this joint and then you started, all of those things and that education piece. So I like the first onset, that 18 to 24 group. I like them. And then my other second favorite would be those traditional old school familiar faces that no one wants to be bothered with. I like them too, because they will tell you, well, look, let me tell you how they used to do it, and that didn't work, and then this worked, and so I have always liked crisis. I have always liked, the people, everybody else go to the left, and I'm going to the right. Well, hold no, come on, hold on, let's see what we need to do. And so, because for them, it's the aha moment. That younger population is the aha moment. Um, I talk about injections a lot, because we have made so much improvement in terms of our psychotropic treatment modalities in terms of medication that most people don't talk about. And so really just doing a lot of education. You don't have to worry about taking this pill every day when you can get an injection once a month. And if you do well on the injection once a month, then you can go to every quarter. And if you do well on every quarter, you can go to 2 times a year. And a lot that reduces the stigma that's associated, that you don't have to take all these medications. You don't have to have a dumping effect after you take the medications. You don't, gain all of the weight that come with some of the psychotropic medications. So it's an educational piece. I like, the educational component of it, and it's ever evolving. And so because it's ever evolving, so is our member consumer base. And so having those conversations and educating them, I like that. It's baby
Um,
steps. We celebrate those little small wins, and so, with the initial encounter, you may not even want to talk to us. And now the fifth time, you like, yes. I mean, okay, before you said, leave me the hell alone. But today you said yes, it's those little milestones. And then we just continue to have those conversations, and be consistent. I think for the most part, they are so used to people saying one thing, doing another, selling them a bill of goods that never pan out, and don't hear them.
I
So
think
I think
also
you
making
have to
sure,
set.
yeah, making sure they know the resources, where they can go if they want help. Because some people may not want it, like Sojourner said, in the first encounter, or maybe even the 10th encounter. But if they have the resources and the knowledge to know where to go when they do want that information, or they do want that help, then I think that's a success in and of itself, is them knowing that they can rely on somebody, and that you're able to be there, for them and connect them to care, even if they're calling because it's cold outside and they need, a connection to a shelter, or they're hungry and you can direct them somewhere to get food. That's a success, because everybody's help looks different. We can't impose the way help looks for us on other people.
Correct.
So, like Sojourner said, recognizing those small things, because different things make different sense to other people. They mean different things to other people. So what I consider help may not be what someone else considers to be help.
And it may not be the help that they need, like you said, we have to define and let them define what that help look like for them. And even if they can't tell us today, say, okay, I'm gonna ask you the question again,
Yeah.
and do that. I'm a little unconventional with my approach, because I don't read past history. I like to have conversation with people where they are in real time. And I like for them to tell me their story as opposed to reading in the past and formulating my own. I'm an old clinician. And so, I've been told I ask very relevant questions. Um, but it's really just having a conversation. And most people don't take the time to have those conversations. And always coming, or even if you're asking questions, it's for to gain additional information, not to again formulate opinion or pass judgment, but for have true knowledge and understanding, and to make sure that we're both clear. So I'm understanding you say this. Does it mean this to you? I don't leave any ambiguity. I have them tell me that story. And for a lot of them, that is the first time that someone has taken the time to let them tell their story, or even just taking the time to be in their space and to just be with them. And so I have always made sure that I memorize what the assessments are before I even meet with a member, so that I can make sure, based on our intimate conversation that we're having, I have checked off all my boxes. Um, and then, I always like to leave people with a resource or something to think about, so that when they leave from seeing me, they can, have that aha moment where, oh yeah, when I was with her, she suggested this, she said this. And I'll tell anyone, prove me wrong. I don't want to be the one that knows everything, because I'm not the be all end all. Um, and so prove me wrong, and to help me help you. I don't know everything. I'm not in these settings. I've been in this field for a long time, but I understand there's a new group, terminology, acronyms, all of that change. And so, educate me, bring me some stuff back so I can know. And and then that way it's not just me, it's giving them some ownership so that they can teach us something too. You know, um, that's what people like. They want to make sure that they are included and they have a sense of purpose. And so I don't care what your diagnosis is, you have a sense of purpose. And so, educate me, so that I can know and we can know together. Even when the petition and clinical certs are filed, completed, and sent over to the court, notifying them and educating them, hey, this is what's being done on your behalf. The deferral conference, that's a missed opportunity right then and there, that gives the member opportunity to, one, get a copy of the petition. Hey, did this happen? This is what they're saying, what's happening. Or even asking them, what happened on today when this happened? All of those are considered moment missed opportunities sometimes because we don't attend the deferral conference. It's another opportunity for their CMH provider to actually have a conversation with them and say, hey, you are receiving services with us. Were you happy with the services? What can we do different? What do we need to do to keep you engaged? What are some barriers that you're experiencing? All of those are conversations we can ask during the deferral conference. And then I also remind them in the deferral conference, that, hey, if any given time you're not happy with your services, there is there's a process to do that, and helping them navigate through that. If we can empower somebody to take ownership and be invested in their own sense of treatment, that is a way of success, because we don't know everything. And so we got to help them and give them that opportunity and that voice to be involved. I love when a member say, "Nope, I want to have a jury trial." And so, most people be like, "Oh, well, wow, I didn't even know that was a possibility." Um, it is, because at the end of the day, this is the member in their life, and if they don't be an advocate for themselves, who else will?
I think they need to be knowledgeable. So the first thing is they need to be knowledgeable about their person. Um, it's critical that you know what the person needs. The court is in the position to listen to the clinicians, to listen to the case managers, to listen to the psychiatrists. So that is sometimes the only way that the member can get what they need if they can't communicate it for themselves, which a lot of times they are not in a position to advocate for themselves at the time of a court hearing or a deferral conference because they have not been treated. So they're in a state of psychosis or delusion, and they're not able to articulate what they need. So in the case of a mental health treatment provider, they have to be able to come before the court and act and speak on that member's behalf as if that member had told them that information, that that they needed something, or they have to put themselves in the shoes of that member to articulate what that person needs. So being knowledgeable about what that person needs, being realistic. So having that historical perspective is not always necessary, but it is sometimes necessary to be able to inform the court about what's realistic for that individual. A lot of times, a hospital may ask for an array of services, but who provides the services in the community knows that that individual is not going to do 5 of those things or 4 of those things. It's best to put that information out for the court to make the decision, so that that individual feels like they have some kind of voice in what is being ordered for them if they don't actually have a voice at that moment. Um, and also, it makes sure that the court is aware of the needs of others. It gets the court in a position to not treat everybody as the same and not just look at people as another court case. It actually gives the court an opportunity to look at people as human beings, as living, breathing people who need things, and are not all the same.
I remember the mayor out of DC, Marion Barry, after he got elected the second time, after he got in trouble with law enforcement, and he said, in order to serve the people, you got to love the people. And so we have to love people on how we meet them and making sure that the service model and delivery is for them and is best for them. And so if that means we have someone who needs an interpreter, we have to have those interpretive services readily available. It's one thing to have a staff, that's fine, but in order to be true transparent, we need to take that an extra initiative and get an interpreter service. Same thing if someone needs an interpreter for sign language, we need to make sure we have those resources readily available. We need to pay attention when it comes time to, even if they need a placement, we place them in a community that they're familiar with, or they know that, they can get those supports from either, if it's a place of worship, or whatever. And so we have to take that consideration, because our world is changing and we need to change as well, because we want to make sure we're inclusive and not exclusive. And so that means asking them, hey, would you mind? Is this the most appropriate? And even if they don't know, at least offering them that opportunity, for them to have the conversation. I'm very big on making sure, we treat people and we engage them and we place them in a community that is culturally appropriate.